of your out-of-pocket costs when using TRICARE for Life. For a more detailed breakdown of costs associated with TRICARE for Life, visit www.tricare.mil/costs. In the U.S. territories like Guam, Puerto Rico, and the U.S. Virgin Islands, Medicare coverage is available, so TRICARE for Life works exactly the same in these locations as it does stateside. In all other overseas locations, TRICARE for Life works like TRICARE Standard. However, you must still have Medicare Part B coverage, or you may lose eligibility for TRICARE altogether. You will visit any TRICARE authorized host nation provider and pay TRICARE Standard cost shares after you've met an annual deductible. Essentially, if you're retired and living overseas, your health care will not change when you turn 65. You'll continue to file claims exactly as you did before. Medicare does not provide coverage overseas. The only thing that's different is that you'll have to enroll in Medicare Part B. Since the contractor knows that Medicare cannot make any payments on overseas claims, the contractor can process the claim without evidence of processing by Medicare. File claims with International SOS Assistance Incorporated, overseas claims processor. For more information, visit www.tricare-overseas.com. OHI is any non-TRICARE health insurance that is not considered a supplement. This insurance is acquired through an employer, entitlement program, including Medicare, or other source. TRICARE is the last payer to all health benefits and insurance plans, except for Medicaid, TRICARE supplements, the Indian Health Service, and other programs or plans as identified by the TRICARE management activity. If you have other health insurance which is not based on your current employment or that of a family member, for example, a private Medicare supplement, Medicare is the primary payer. The OHI is secondary, and TRICARE will become the third payer. In this situation, after Medicare pays its portion of the claim, Medicare forwards the claim to the other health insurer for processing and payment. If there is any remaining balance, you, the beneficiary, will need to file a paper claim with WPS and must include the EOB from Medicare and the OHI. Submit paper claims to WPS-TRICARE for Life, P.O. Box 7890, Madison, Wisconsin 53707-7897. TRICARE Plus is a primary care enrollment program that is offered at select military treatment facilities. All beneficiaries eligible for MTF care, except those enrolled in TRICARE Prime, a civilian HMO, or Medicare HMO, can seek enrollment in TRICARE Plus if enrollment capacity exists. Please note, TRICARE Plus is not transferable from MTF to MTF. Unlike Prime, TRICARE Plus is not portable, and availability can change if MTF capacity decreases. Non-enrollment in TRICARE Plus does not affect TRICARE for Life benefits or other existing programs. If you don't have Part B and the care is not available in the MTF, you will be responsible for all the charges because you will not be covered by TRICARE. TRICARE offers robust prescription drug coverage to all eligible beneficiaries, including those with Medicare eligibility. TRICARE has a uniform formulary process that establishes 3 separate types of medications, or tiers. Tier 1 formulary, generic. Be aware that TRICARE policy requires the generic equivalent for any brand name drug to be dispensed if available, unless your provider establishes medical necessity. Tier 2 formulary, brand name. Tier 3 non-formulary. Non-formulary medications can be dispensed, but at a higher cost. If your provider can establish medical necessity for a drug on the non-formulary list, you can obtain the prescription at the formulary cost. Costs for prescriptions are based on the category under which the drug falls, Tier 1, Tier 2, or Tier 3, and where the prescription is filled. We'll discuss cost in just a moment. Pharmacy benefit information, including authorization requirements, quantity limits, frequently asked questions, and more, is available at www.tricare.mil/pharmacy or www.express-scripts.com/TRICARE. As you may know, Medicare Part D now offers prescription drug coverage. There is no added value to purchasing Medicare Part D, and you are not required to do so to remain eligible for TRICARE's robust pharmacy coverage. Please weigh your options carefully before purchasing Medicare Part D. You may use the TRICARE pharmacy benefit unless you are enrolled in the U.S. Family Health Plan. To have a prescription filled, you will need the prescription, a valid Uniform Services ID card, and up-to-date information in DEERS. Please note, pharmacies are legally permitted to copy military and dependent ID cards to verify TRICARE eligibility. You will normally receive a generic drug rather than a brand name drug. Your doctor or other provider must provide medical necessity for you to receive a brand name medication if a generic version is available. Non-formulary drugs are not available to active duty service members without medical necessity approval. If the ADSM receives approval, the copayment is $0. Pharmacy costs depend on the pharmacy option you choose, whether the drug is generic or brand name, and whether it's listed in the TRICARE formulary, which is the list of drugs covered by TRICARE. There is no copayment when you fill a prescription at an MTF pharmacy. If you have recurring prescriptions such as allergy or blood pressure medicine, you can use TRICARE Pharmacy Home Delivery to order up to a 90-day supply by phone, online, or by mail. TRICARE Pharmacy Home Delivery copayments are $0 for generic formulary drugs, $9 for brand name formulary drugs, and $25 for non-formulary drugs. If you need a prescription filled immediately, your best option is to find one of TRICARE's 60,000 plus retail network pharmacies. To find a retail network pharmacy, visit the Express Scripts website provided at the bottom of the screen. The most expensive option is a non-network retail pharmacy. The TRICARE dental program is available to eligible active duty family members, members of the National Guard and Reserve, and/or their eligible family members, and transitional survivors. Benefits include voluntary enrollment and portable coverage worldwide, single and family plans available, low monthly premiums and cost shares based on a sponsor's pay grade, comprehensive coverage for most dental services, 100% coverage for preventive, diagnostic, and emergency services. For more information, visit www.tricaredentalprogram.com or call 1-888-622-2256. The TRICARE Retiree Dental Program is available to retired service members and their eligible family members, including retired National Guard and Reserve members, as well as survivors. Benefits include voluntary enrollment and portable coverage nationwide, single, two-party, and family plans available. Monthly premiums vary regionally by zip code, minimal deductibles, and cost shares. Comprehensive coverage for most dental services. Visit any dentist within the TRDP service area. For more information, visit www.trdp.org or call 1-888-838-8737. Overseas dental program options include the TRICARE Dental Program and the Enhanced Overseas TRICARE Retiree Dental Program. For more information, please visit the websites provided. The Uniformed Services Family Health Plan, or USFHP, is an additional TRICARE Prime option available to active duty family members and retired service members and their eligible family members, including those aged 65 and over, through networks of community-based hospitals and physicians in 6 areas of the country. Please note, although Medicare-eligible beneficiaries are not required to have Medicare Part B coverage to enroll in the USFHP, we strongly recommend that you get Part B when you are first eligible to avoid surcharges if you decide to enroll at a later date, which is 10% for each 12-month period after your initial enrollment period. For instance, if you move from your USFHP location and it's not offered in your new location, you will not be eligible for TRICARE without Medicare Part B. If you enroll in the USFHP, you are not eligible to use other TRICARE options or benefits, including the TRICARE pharmacy benefits discussed in today's presentation. For additional information, please visit www.usfhp.com. If you have any comments or additional feedback to this presentation or any other marketing and education materials, please visit www.tricare.mil/evaluations/feedback.